I'm Dr. Lauren Mathis, and welcome to my website, www.wichitafallsdizzinessdoc.com. Now, I'm assuming that you've come here because you're frustrated. Frustrated because you've been diagnosed with dizziness, vertigo, balance disorder, or Meniere's disease, and you're looking for information. You're looking maybe for an alternative. Maybe you're tired of the medical merry-go-round. Here, try this pill. That one didn't work. Well, let's try this pill. Or maybe you've just been diagnosed with dizziness, vertigo, or balance disorder, or Meniere's disease, and you're looking for information. You're looking for some solutions. Maybe a natural solution, a non-drug solution, or maybe you're just tired of having dizziness, vertigo, balance disorders, and Meniere's disease for a long time and not getting any results. Whatever brings you to my website, welcome. You've come to the right place. Now, before we get started, it might interest you that if you're a senior citizen to know, you know what the #1 leading cause of death in the United States is among seniors? It's falling or complications from a fall. Falling because you're dizzy, you have vertigo, and you have a balance problem, or you can't tell where your feet are. This short video will give you a brief overview of dizziness, vertigo, balance disorders, and Meniere's disease, and how I help people with my program called Brain-Based Therapy to relieve these symptoms and get you back to normal and feeling better again. Now, because I shared the example of senior citizens, don't think this is a problem that's just isolated to senior citizens. Nothing could be further from the truth. If you look immediately below this video, there's a testimonial from one of my patients. His name's Lonnie. Lonnie is a weightlifter, a bodybuilder. He eats a special diet, believe me. He works out regularly, and he does a lot of things right. Yet, he developed dizziness and vertigo that we were able to help him with. And I'll explain to you exactly how we did that. There's 3 main players that come into play when you're dealing with dizziness, vertigo, balance disorders, or Meniere's disease. They are the cerebellum, your inner ear or vestibular system, and your feet. Okay, we check out each 3 of these areas when you come into my office. What's the cerebellum? Well, it's the part of the brain that's located right back here. It's a very important part of your brain. 90% of everything that either goes to your brain or comes from your brain passes through the cerebellum. The job of the cerebellum is to help you with coordinating and controlling balance, movement, and your thought processes. And that means that when this area goes weak due to stress, poor diet, injury, trauma, that you're going to have problems with knowing where your body is in space. You're going to have problem moving properly and correctly in a coordinated way, and you're going to have trouble with your thought process. What's often interesting is that when people come in with balance disorder, I often find that they are unable to complete sentences or complete a thought because the cerebellum controls that. Your cerebellum also talks to your brainstem. Your brainstem, as you may or may not know, controls things like heart rate, breathing, and your gut. So when it gets weak, the brainstem doesn't get the proper information that it should be receiving from the cerebellum, and you develop problems with your gut like nausea and projectile vomiting. Your heart, you can have a racing heart rate, and breathing, you might have breathing difficulties along with this problem. So the cerebellum is a big player, and it's often overlooked when you go see a practitioner. The second area that we look at is the inner ear, or what's called your vestibular system in fancy medical terms. Your vestibular system is the semicircular canals in your ear. And when there's a problem with that, you can develop a condition known as benign paroxysmal positional vertigo. And often, most practitioners aren't even aware of this condition, or let alone how to deal with it properly. The proper treatment for that often can be a procedure called Epley's maneuver, but yet most practitioners don't know how to do it properly. The third area that we look at is foot problems, and knowing where your foot is in space, what we call proprioception in medical terms. If you don't know where your feet are, that's a big problem of balance disorder. Now, the most common drug for balance disorder is Maclazine or Antivert. You may have even tried that. And Maclazine and Antivert are only designed to work for inner ear problems. And they don't even work that well that often. You may have said, yeah, I've tried that and it didn't do anything for me. There are no drugs that I'm aware of that help you with your cerebellum or with your foot problem. So, you may be sitting there wondering, well, how do you help people that have dizziness, vertigo, balance disorders, and Meniere's disease? Well, there's basically 5 steps, and I'll just cover them very, very quickly. I do what's called brain-based therapy. And what we do is we treat you, and we don't treat your label. Okay, labels are for jars and cans. They're not for people. What we do is we bring you in, and we do a thorough neurological evaluation of your brain and your nervous system. Okay. to discover where the problem lies, where the lesion lies that's causing the problem. Your brain and nervous system needs two things. It needs fuel and it needs activation. Fuel comes in the form of the food that you eat, so we take a very careful look at the diet that you're eating. That often can be a big part of the problem. And also oxygen. Your cerebellum is the most oxygen-dependent part of your entire brain. If you have a breathing problem or you're not getting enough oxygen, that can often be the cause of it. And there's a specific way that we treat that. Also, your brain needs activation. What we do in our office is we give patients TLC, tender loving care, but it also stands for therapy and lifestyle changes. Therapy are exercises and different activations we do to strengthen your cerebellum again. Like a muscle, it needs to be exercised to get strong. And we do some of that in office, and we also design a home care program for you also. Lifestyle changes involves, again, like we talked about diet, different things that you're doing that may be causing your problem. We look at that. The fifth thing that we do is we do metabolic testing in our office. Specific lab tests that show us where weak areas are in your body. And when we find those weak areas, we support them with the proper supplementation so that you can heal faster. Ultimately, that's the goal of everything that we do. Now, if you're looking for more information, there's two ways that you can get that. I have a 45-minute DVD that I'd be glad to send to you free of charge. Right above me should be a button that says Contact Us. You can click on that, call our office, and request the free DVD, and we'll mail it out to you right away. Also, down below me here on the page should be a box where you can fill out your name, address, mailing address, and telephone number, and we'll be glad to send you that same information. This is Dr. Lauren Mathis. I want to thank you for listening. Have a great day.